Osteoarthritis affects an estimated 32.5 million adults in the United States alone, and its prevalence is growing globally. The pain, reduced mobility, and decreased quality of life associated with OA create a significant burden for individuals and a considerable strain on healthcare systems. While we have treatments to manage symptoms, a cure remains elusive. That's why innovative approaches like leveraging the power of generative AI are crucial. But what exactly is generative AI? In simple terms, it's a type of artificial intelligence that can generate new, original content. This content can take many forms, including text, images, audio, and even data. Think of it as an AI artist or composer that can create something entirely new, based on what it has learned from the data it was trained on. Examples of generative AI include large language models, diffusion models, and generative adversarial networks, GANs. Essentially, these models are trained on massive datasets, millions or even billions of examples. They learn the underlying patterns and relationships within that data, and then use that knowledge to create new outputs that resemble the data they were trained on. One key capability is data augmentation and synthesis. Gen AI can create entirely new data points that are statistically similar to existing data. This is incredibly valuable when data is scarce or when you need to address biases in your dataset. For instance, in medical imaging, we can generate synthetic images to augment real patient data. Generative AI can create personalized content such as customized exercise routines based on individual patient data. This allows for treatments that are highly specific to the patient's needs. Gen AI can also be used to predict and simulate outcomes, helping doctors choose the best treatment plan for their patients. In osteoarthritis research, we often face the challenge of limited datasets, especially with medical images. Generative AI, specifically GANs, can generate synthetic X-rays or MRIs of joints that look remarkably similar to real images. This augmented data can significantly improve the accuracy and robustness of AI models used for diagnosing and monitoring OA. Furthermore, generative AI can simulate clinical trial data, allowing researchers to explore different treatment scenarios, predict outcomes, and optimize trial designs before conducting expensive real-world trials. One of the most promising applications is in creating personalized treatment recommendations. By analyzing a patient's medical history, imaging data, genetic information, and lifestyle factors, Gen AI can generate individualized treatment plans tailored to their specific needs. However, it's crucial to acknowledge the limitations and challenges. One of the biggest concerns is data bias. Generative AI models are only as good as the data they're trained on. Ensuring diverse data sets is essential. Another challenge is the lack of transparency and interpretability, often referred to as the black box nature of some AI models. In conclusion, generative AI holds immense potential to revolutionize the management of osteoarthritis. By embracing this technology and addressing its limitations, we can pave the way for more accurate diagnoses, personalized treatments, and ultimately, improved quality of life for millions of people living with OA. Thank you.